Hello, I'm Dr. Greg Wintereg. I'm a dentist and a partner at MGE. And for this week's tip of the week, I would like to talk about the business of dentistry. Now, it's a lot more fun to talk about 3D x-rays, lasers, and CAD cams than it is to talk about business of dentistry. But the truth of it is, when you sign a lease, you sign a loan, then you're in business. And I just want to go over with you just the regular coordination meetings that I had with my office manager and my staff so that we can actually confront the business of dentistry. So every Monday morning for 1 hour before we saw patients, I met with my office manager. We went over the previous week's statistics, how much promotion was still left to be mailed out or what we were doing from a promotion standpoint, what policies do we need to work on at the office? Were there any problems that came up the previous week that need to be addressed? And so it's she and I sitting there and just really confronting everything that goes on in the business. We got a quarterly profit and loss statement. We would sit down, we would go over that. And is the overhead going up? Is it going down? So it's just a matter of just like really confronting all the numbers of dentistry. So we would do that for an hour. Then we would go in and we'd have our morning huddle from 8 o'clock until 8:10. We did that every morning. And then on Mondays, she would run the staff meeting in the afternoons over lunch for an hour. And on Monday, everybody knew to bring their lunch, and we just had a 1 hour staff meeting. And at the staff meeting, it's all about communication, it's about coordinating, handling anything that came up from the previous week that anyone was upset about. Then on a bigger picture, every 8 weeks, we would close on Thursday afternoon. We would work from 8 until noon on Thursday morning, grab some lunch and go to a conference room, and we would look at the statistics and what had happened in the previous 2 months as a group and come up with our strategy on what we were going to focus on and work on for the next 2 months. Now, this sounds like an awful lot of meetings, but actually once you kind of get into a pattern of it, it goes pretty smoothly. And the key here, and the point that I really want to stress and emphasize, it's all about confronting what's going on and communicating about it. I also had 2 meetings a year, every 6 months, with my accountant to look at the first 6 months and how are we preparing ourselves for the last 6 months. All right, how are we doing from a tax standpoint, setting money aside. So again, it's about like really confronting the business of dentistry. And it's a lot more fun to go to dental continuing education and learn new dental techniques and buy new pieces of dental equipment. And I mean, that's where we got into the profession to do that. But once you're in business, these other areas have got to be confronted. And I'm just encouraging you minimally have a staff meeting once a month to at least get the ball rolling, because there's communication and upsets that aren't being discussed. And if you just ignore it, pretty soon it can turn into a huge fire and a huge problem, and that's no fun for anyone. So my advice out of this week's tip is figure out a way to have some regular organizational meetings, schedule it into the book, no patients during that time, and that's scheduled just routinely every single week. And that's my tip of the week.